Introduce yourself first.
Yep, I'm Cheryl Cousins, Clinical Assessor for Call for Care.
Hi Cheryl. Tell us a bit about a typical scenario where you might get called out to someone's home.
Okay, well I can give you an example of someone that I went to visit the other evening. It was a lady that was referred to us by a GP who had been contacted by the family because she'd been asleep in a chair all night. She was struggling to cope at home on her own. So we went out to visit her. This lady was sat in the chair. She was a little bit confused, but medically she was well. We checked all her observations. She had a little bit of edema in her feet, which wasn't helping with her mobility. So we did a full holistic assessment, checked her observations, decided she was safe to stay at home, but we needed to arrange care overnight. It was late in the evening. Because of her confusion, we were worried that she might try and get up and she was at risk of falls. So we contacted social services to try and arrange an assessment bed with her consent and her family's consent. We weren't able to arrange that the same evening, so we arranged cover from our district nurses' evening service. They popped in overnight to make sure she was safe, and then we carried on with our social services referral in the morning, and they got her into a assessment bed. Fantastic.
How does that make you feel when you look back on your on that example and realise that that person got the care they needed?
Very proud, obviously, of the service that we're providing, but it was nice feeling for the family because obviously they didn't want to see her. There was an elderly lady. They didn't want to see her go into hospital. That wasn't the right place for her. And she ended up getting the care that she needed, so everyone was happy.
Fantastic. Thank you. That's it.